of the Anchorage Assembly Public Safety Committee. It is Wednesday, September the 2nd. And Mandy, if you could make sure we're, oh, you've started the recording, so it sounds like we're good. So, okay, and so Mandy, if you could do roll call for us, please. We'll start with that.
Yes. Miss Kennedy?
Here.
Mr. Perez-Verdia?
Here.
Mr. Peterson?
Present.
Mr. Constant? Mr. Dunbar?
Here.
Miss Salatel?
Here.
Miss Quinn Davidson?
Here.
Mr. Rivera?
Present.
Mr. Weddleton? Miss Allard?
Here.
Miss LaFrance?
Here.
Okay, thank you.
Thank you, Mandy. All right, and I know we've got staff joining us as well, but I think we'll wait until we actually need to introduce some of them. This is always a little difficult with people that are phoning in. It's hard to kind of chime in on things when you're on the phone, but I will certainly try to watch the queue, and hopefully there'll be a chance to open it up too for people to answer specific questions that are online to do that. So we have the agenda. Hopefully you all have a copy of that before you. Mandy, I don't have the ability to share my screen because I use an iPad. Are you able to put the agenda up for us just to kind of help keep us on track too?
Sure.
Great, if you could do that, please. So I just wanted to open up to make sure that there's nothing we need to add to this agenda. I think we certainly have a lot to talk about today, but I want to make sure we're not missing something at this point. So if there's anything to add, I'm not hearing anything. So we'll go on and we'll start up with a couple of our updates from the fire department and the police department. And first on our list is Anchorage Police Department. So Chief Dahl or Deputy Chief McCoy, whoever's here. I'm not sure exactly who's presenting. So whoever is, just jump in. Thanks.
Thank you, ma'am. This is Justin, and we're both here. I'm going to be doing some presenting, and I'll probably make an attempt to take over the screen.
Glass because it has antioxidants or something.
If you're talking about antioxidants,
I was reading this morning. I was like, this is pretty bad.
Hey, Austin, you need to mute yours.
One second here.
Oops, sorry. I was talking about not this committee meeting, something else.
We noticed.
Sorry.
It's all good. This
right.
Technology is wonderful, but also challenging. Anyway, so I've got some things to show everyone. So I'm going to try to take over the screen here for a little bit and share some interesting things. So let me see if I can do that. So right now you probably see the agenda, which is not that exciting. So the first item on the agenda for APD is just a little bit about crime stats. I've talked individually with some assembly members recently about crime stats and what's going on there, but generally the news is not terrible. We're seeing sort of downward trends in almost all categories of crime reporting. So the first chart I have up, Ms. Kennedy, can you see this okay? I just want to make sure that I've actually done it right.
Yes, I see it just fine. Good job.
Okay,
Thanks.
excellent. Thank you. So the first chart I have up, note the time period is January 1st through July 15th of each of the years presented, 17, 18, 19, and 20. We prepared this information a few weeks ago, and it's just the most recent chart that I have. We've had one homicide since then, so we've actually had 6 total so far this year. But if you look at the last few years and compare it to 2020 so far, the trend for homicides appears to be downward, which is good. We hope to see that continue through the rest of the year. We're putting lots of effort into our partnerships with state and federal law enforcement to reduce violent crime. And that's the next chart that I have, is just a more kind of a broader sort of overview of violent crime, calls for service, which are direct reports from Anchorage residents. So you can see assault is trending downward pretty steadily. Sex assault is down a little bit compared to the last few years, but still higher than we'd like to see it. And also robbery has been trending downwards, even though we had sort of a little string of robberies recently. Although you may have seen, it was reported, I think yesterday in local media, that our robbery assault detectives made an arrest there. So, and we continue to see them be very successful with the cases they're working along with homicide. A quick look at property crimes. Again, just some general categories to give kind of an overview. Theft is trending downward. Also, we're continuing to see declines in stolen vehicles, which is good. We all know that 2018 was not a great year for stolen cars. Same thing with burglaries. Vandalism is something that's sort of holding steady, but down a little bit this year. And shoplifts are down. And I suspect, I get asked frequently if all of this downward trending stuff is as a result of coronavirus. And I generally say, I don't think so, because we saw these trends begin kind of the end of last year, or maybe last fall, and continue into this year. I think the one exception to that might be shoplifts, where I suspect there is a likelihood that this category has been impacted somewhat by shops being closed. And, you know, we've seen kind of off and on some restrictions to the number of people that can be inside stores and things like that. So I don't have any evidence to actually support that, but that's just my wild ass guess, basically. So I will pause there briefly if there are any questions about that before I move on to our next bullet point, which is capital project updates.
Great, thank you. And it looks like we've got some questions here. One from Mr. Perez-Verdia.
Yes, thanks, Chief. I just want to clarify, it says on this slide, calls for service. So can you explain of the slides as you've already presented, are these calls to report this? Are these actual verification that the crime happened? What are these stats, and how do they fit into the process of you know, whether it's reported, whether it's an actual crime, whether they're prosecuted, that sort of thing? So
no, sir. Thanks for that question. That's a very astute question. This is the confusing part of when we start talking about what's happening, because we have like uniform crime reporting, which are verified crimes that get reported to the federal government. We have calls for service, which are what people call and tell us. These charts are, so the first chart was homicide victims. So these are just actual homicide victims in these years. But the other two slides with charts are both calls for service based. And the reason I chose calls for service, even though there are different ways to look at kind of all this stuff, I think calls for service is a good representation of what the community feels like, because this is what people are reporting to us. And so when we sort of talk about crime rates or, you know, how, you know, does it feel like things are getting better or getting worse? I think calls for service are a good indicator, because that's what people are seeing and calling and telling us. There are other times when other measurements I think make more sense, and we talk about, as you mentioned, sort of verified crimes. It's like, okay, well, this was reported as a robbery, but you know, we got there and it's actually a burglary or something along those lines. That's actually not a great example, because that gets cleaned up a little bit earlier, but there is some classification that happens. So when we do our annual stats reporting to the federal government, these numbers will probably look a little bit different, but I thought that this was a better sense of kind of how things feel. So that's why I went with that. Did I answer your question, sir?
Yes, thank you. And I just want to make sure I'm understanding. So these are just people reporting these crimes, and it may not have been a crime. It may have been, it may have been a crime. It may not have been a crime. It may have been a different crime. But this is someone actually calling into the call center and saying, I'm reporting this happening, and it gets logged at that point, not when someone's gone out and checked on it. Is that correct?
Well, yes and no. It's confusing, because what you're saying is correct. That's how things come into the call center. That's how they initially get reported. There's some initial scrubbing that happens. Something might be called in as an assault, and an officer goes to investigate it, and it turns out it's actually a vandalism, and that might get corrected right away, and it might not get corrected until classifying goes through it. But when we pull this, there may be some of that initial correction that happened by the responding officer. But maybe not. So
Okay.
it's a little bit less, it's a little bit more sort of ethereal than the final scrub numbers that we report to UCR.
Super. Thank you. That was great.
Okay, thank you.
Thank you. And yeah, that was a good question, Mr. Perez Verdia. So thanks for asking that one. Any other questions? And I just might need to clarify for the record that I believe we have Mr. Constant on with us. It looked like, I don't know if he was getting kicked off and on again, but just want to make sure that we have Mr. Constant with us. Okay, well, if there are no further questions then, Chief, anything else?
Yep, I just have a couple more things relatively quick. The committee had asked for sort of an overview of capital projects at APD and where they are. So we have sort of 3 main projects that are going right now. The largest is the renovation of the Elmore facility, what was the old police station. And we're converting the vast majority of that to property and evidence storage, which we've needed for a long time. We're at the 95% design phase. And I believe that it's ready to go out for bid for construction if it isn't already. And we would like to begin construction this fall and do construction throughout the winter. So we think that we have a very good design for that. We think it's going to be really, really functional for the department and all the people that still work there. And so we're excited to see that project continue. I had hoped to actually start construction this spring, but obviously pretty much everything in the world slowed down this summer. So we're a little behind where we'd like to be, but that's okay. The other project is the sort of a renovation of the Jewel Lake training facility. That facility is where the police academy happens, and many of the assembly members have been there for Citizen Academy or other demonstrations by the police department. It was converted from a Safeway store in the mid-90s, I think 1994, and it really hasn't been updated since. So it's just in need of, it's a much sort of lighter weight project there, and it's sort of in need of a facelift. So we have some voter-approved bond money to do that, and we're working our way through it. And that project is also, I think, at about the 95% design level. Actually, I think that one has already gone out to bid, and we may be getting ready for construction. So we think that construction will happen over the winter as well. It'll be a little bit complicated because we always have a police academy in session there, so we'll have to kind of do construction around that and move the recruits around a little bit, but everybody's ready for it. So we're good to go there. And then I think the final one is actually back at Elmore again, and it's even less exciting than the other two, and it is replacing the boilers in a large chunk of the heating system for that building, and that's just happening along with the other renovation. And so, unless there are questions about that, which I would be somewhat surprised to hear, I'm going to roll right into just a little bit on staffing. There have been some questions about where we are with staffing inside of APD. So this is kind of, this is just a snapshot that I use as a tool about once a week or once every other week, just to see what our overall staffing looks like, where our vacancies are. And it's just drawing the information straight out of SAP and then using an Excel tool that I built to kind of massage a little bit so it's readable. But essentially, if you look at this, we actually look pretty good. We have 621 authorized positions. We have 25 vacancies right now, 596 employees on board. You'll see that we just have 13 sworn vacancies, which is pretty good. I expect our recruiting is going really, really well right now. There are lots of people that are interested in working for the police department as sworn officers, and so I expect that when we begin the December Academy, we'll probably be able to fill up to 100%, at least until the next person leaves. If you look at, and of course we have 32 officers in training right now. We just had 4 start on Monday that are lateral hires from other agencies inside Alaska. If you look at our non-sworn folks, you can see we have 4 dispatch vacancies. We're actively recruiting and actually going through the backgrounds process for applicants there. We have 4 essentially police clerk vacancies. Same thing, we're actively working through the process to bring people on board there. We're working to hire what is sort of cryptically labeled as an identification technician. Really what that is somebody to work in our crime lab. And we're working on hiring somebody for that. There's 2 evidence technicians. Those are the folks that work in the property and evidence section. We're actively trying to fill those. And then crime prevention specialist. We've been recruiting for that. We had somebody who left after 30 years and we're working to fill her slot. And I think that person might be coming on board, hopefully in the next few weeks. We think we have a candidate identified. So that's a quick overview. Let me back up real quick to capital projects. I knew that there was one other one and I couldn't remember what it was until I read identification technician. So the other project that we have going is moving our crime lab into the state's scientific crime detection laboratory. We've been working on that for about the last 9 months or so, and figuring out, how to modify our lease agreement with the state, because the crime lab is built on municipal land, and how to work out an MOU for our folks to exist inside their lab space, which, obviously there's some technicalities involved because they are a certified crime detection laboratory. So we have to make sure that all of the different parts line up so they can stay certified and our people can work in that environment and produce, good evidence for prosecution. We're doing a little bit of renovation there to sort of convert some space they have into office space, but it's very lightweight. And mostly our folks are going to move right into the very, very nice and frankly, well-designed and advanced laboratory space that they have that they were not using. And then both teams are going to be able to work together on things. So we're really excited about that. And one other item of interest regarding staff is you can see that on the list of staff, there's a DNA analyst that shows as filled. That was a project from last year where there was some assembly interest in seeing that position filled. That person just completed her final sign-off to be fully certified as a DNA analyst working over at the state crime lab. And so she can actually work cases now, and that just happened. That process took almost a year, and it just happened in the last couple of weeks. So she's actually working cases now. So that's also good news for us. And I think that rounds out all the things that I had planned to talk about, but happy to answer questions about any of that stuff or anything else at APD.
Great, thank you, Chief Gull. I do want for the record to point out that we've been joined by Assembly members Constant and Weddleton a few minutes ago, so just make sure that we've got them recorded. So any questions from the committee? Very quiet out there.
All righty, thank you very much.
Thank you, Chief, appreciate it. So. Okay, next on our agenda is the Anchorage Fire Department updates. And, just to let kind of the members know, we're going to try to do this on a more regular basis. It seems like the idea of having updates has been a little bit hit or miss. And not that we want either the fire chief or the police chief to have to go through, a huge list of all the things that are going on, because we know they're busy and we know there are a lot of things going on. But we do think it's important that we get some of these updates just to kind of make sure that we're keeping up with some of the things that they might need from this committee. So anyway, Chief Hetrick, welcome. Thank you for being here. Take it away.
Good afternoon, or I guess it's still morning. So good morning, everyone. I'm going to do pretty much the same thing that Chief Dahl did. I'll share my screen and kind of go over the stats that were submitted or that we presented. Is it showing?
Yes, we see your screen.
So we have One, I just want to clarify, I don't have fancy graphs and stuff like Chief Dahl does. We are in the midst of a vacancy with our normal data person who would make me look way better than just a regular Excel spreadsheet. So just kind of to go over everything with everyone. First section is dispatch. So I have everything broken out by dispatch, operations, and then our fire prevention section. So unfortunately, when COVID happened, our data analyst person that typically manages all of our data for us went to work at the EOC, and then they had a vacancy and we lost her. And she had been with the department for a significant amount of time. So we kind of have a gap with our data. And we also realized that we had not been tracking some of our dispatch stats the way that we wanted to. So with our new dispatch battalion chief, he's putting some stuff together. So right now for the dispatch information, I only have it on a monthly basis. In the October meeting, we'll have more trend information. So in August, we saw 2,700 911 calls, and those are obviously transferred from APD to us. And this is everything from fire-related incidents, EMS, all other hazards, or anything that law enforcement would not cover, typically gets transferred over to AFD. And just some highlights of that is out of those 911 calls, 34 of those were active cardiac arrest events that our dispatchers coached people through doing on-scene CPR and other mitigating efforts to ensure that by the time our crews get on scene that already care is being provided. Other significant responses are structure fires, hazmat calls, vehicle extrication calls. That all entails about 20,000 radio traffic messages back and forth that our dispatchers have to monitor to make sure that they're basically the safety oversight and listening to all the radio traffic. And sometimes they can catch things that are happening on scene that our responders aren't aware of. And one thing that most people are not aware of, because we have a limited number of hospitals within the community and they have limited number of space in the emergency rooms, it is common for them to run out of resources, and then we have to divert patients from, even if we're en route, from one hospital to another hospital. So our dispatch center right now manages that whole diversion process. The hospital will call dispatch and say, hey, our beds are full, we're going to divert. The only thing we can take is pediatric calls or something along those lines. So our dispatch center has to manage the routing of all of our EMS units. So that's 13 ambulances that they're making sure get to a hospital that is actually open. So they had to do that 235 times this year. It really comes down to capacity, and that's a pretty normal number for us during a month. COVID has not slowed that down. It's actually made it a little bit more interesting. We also dispatch for Anchorage Safety Patrol, and you can see the numbers of calls there. The non-critical transports, for a while, when the EOC, when everything was kind of in maintenance mode at the EOC, AFD dispatch took over dispatching the private ambulance services that were taking care of people who were COVID or indicated COVID positive, but didn't have transportation to get to a medical facility for testing or follow-up care. So the EOC set up that system and AFD was dispatching it and making all of that happen. Now that cases have increased and we've had days where we have 25 to 30 of those patients on top of our normal call volume. So actually yesterday, the EOC took that task back over, which was very helpful for us because it was getting, we were getting a little busy. We also dispatch for private ambulance services. That was 543 calls this month. That's a pretty normal number for that group too. We are also responsible for dispatching the Alaska Police and Fire chaplains. And in many cases for cardiac arrest calls or other traumatic events, when the emergency crews, we wrap up and we finish what we're doing, and we don't just walk away. We actually rely on the police and fire chaplains group to show up and help with that transition for the family members and make sure that there's somebody there to take care of them. Some of the administrative things that the dispatch center does is they take care of the Comfort One registry packets. So in Alaska, or in Anchorage, we have about 1,700 people who are have Comfort One packets, and that basically means they're at the end of life and they're in hospice care, or they're close to death, and their family has chosen not to have any extensive medical measures. So we track all of those and maintain those so that we know if we get called to that location, we have accurate documentation so our crews know what they can and cannot do with the patient to meet the patient's requests. Right away reports every time a road gets closed or there's a permit or anything, dispatch takes care of that. And we are also part of the chain when there is donations. People are making organ or tissue donations to Life Alaska. So we're part of that chain of communication that happens as well. That's on top of the 5,833 calls that you see there for administrative. That's fire alarm notifications, confined space notifications, comments, questions from the public. And right now that's a fairly low number. Our biggest numbers are when we are dealing with burn bans, and we get a lot of calls for people just asking a ton of questions on whether it's okay to burn or not burn or what the rules are. So just for the month of August, they saw over 11,000 phone calls. And I'll get to the staffing so you can understand where staffing is. For our operations, yep.
Can I interrupt you here, please,
Yes,
just
ma'am.
for a second? Mr. Constant has a question for you.
Okay.
Mr. Constant?
Thank you very much. Chief, you were speaking on diversions. That is a very interesting topic to me. So in years past, and I don't know how it is this year, we have heard kind of terrible stories that APD is finding itself being the place of last resort for people who are experiencing mental health crisis. And in particular, one hospital says they're on divert, and the next hospital says they're on divert, right up to API, which says we have no room. Is this the category that those calls would fit into, or are those somewhere else? And this might be a co-question between you and Chief Dahl. And is that still a functional reality that we're facing? Has it gone down with the increase of beds at API? Can you just kind of tap into that conversation a little bit for me?
So yes, and a little bit of no. So the diversions, this covers everything. This is not just psychiatric diversions. This is all types. So the psychiatric diversions are included within this. And what happens when a hospital goes on divert, then we go to the other two hospitals. But if all three hospitals are on divert at the same time, which happens on the psychiatric side of things on a fairly regular basis, then they go in rotation. So then dispatch manages that, okay, it's Alaska Regional's turn, and then the next patient will go to Providence, and the next patient goes to ANMC. So when all the hospitals are full, they just then go on rotation. Somebody still takes those patients. What APD experiences is when the patients maybe don't need medical care, or they don't meet the criteria of an admit for a psychiatric event, then that's a different type of divert that then we try to figure out where those patients go, which is sometimes API. But it is, yeah, it's all part of a bigger problem of, with our current need for services, for emergency services and mental health services, if we don't have some place to take people, we have to kind of force them into the system, and that just causes overloads up everywhere else. So when API or some other facility kind of shuts down their ability, it does significantly affect where we can take our patients to.
So just quick follow-up then, maybe at some point between police and fire, we could get a briefing on that specific process, maybe some data on how often and maybe the trends over the last few years, so that we can continue to have a very informed view of how we implement the core team increase or any kind of increase of kind of mental health interventions through the police department. I think that that's an unsung tale that needs data to it. Thank you.
Yes, we'll be happy to do that.
Thank you. And can I just interject? Actually, part of that conversation is on our agenda for a little bit later, to kind of, like Mr. Constant said, start that conversation to see how all these efforts are coordinated and what we can do about synthesizing things. So anyway, we will have a little more conversation on that, Mr. Constant. So thank you for the question. And go ahead, Chief. Thank you.
Okay, so for operations responses, we unfortunately, as I mentioned, our data person is no longer here and left us in March. So we only have 2020 data through the end of March. However, at the beginning, before COVID affected us all, we were actually trending up in all of our categories. We had increased from an average of about 95 to 96 calls a day. We were already into the 100 calls a day to maybe 102 calls a day. Then when COVID hit, emergency responses dropped off significantly, especially on the medical side of things, which was definitely good because it gave us an opportunity to focus where we needed to focus on our preparation for COVID response. But we are starting to see those numbers come back to normal. And hopefully in October, I will have some more information that can really show the trends. But I will say in the last 5 years, we have seen an increase in our response volume, about 18% increase in our response volume when we compare to 2014 numbers. And it does fluctuate a little bit depending on what's going on, but that's pretty across the board. We're seeing an increase in responses in all of the categories. So in the chart that I'm showing, all the kind of pinkish red colors, those are all fire related calls. The others are, the green ones are EMS related. And out of the 6,238 calls that were rescue and EMS, 4,795 of those were transports. So that 4,795 doesn't get included in the 9,000 numbers total. So we transport on average every year about 19,000 patients, and we respond to about 25,000 emergency response calls. And Assemblymember Perez Veridia brought something up the other day. Well, what is that in comparison to? So I actually did a little research and compared to what our patient encounters were compared to the hospitals. And from what it looks like, for example, Alaska Regional Hospital in 2018, they had a total for the whole hospital of 37,000 patient encounters. And AFD that year had close to 25,000. So if you put us in line, it looks like we're probably the 4th largest provider of emergency medical care in the community. And we do this with 13 mobile emergency rooms is really what our staff do, is we bring the emergency room to you and start treatment before they get to significant care. See, and fire prevention. So I do like to brag a little bit about our fire prevention unit. It is a pretty small unit, and they are very focused on reducing loss of life and property to fire. So they take care of any fire-related code enforcement and inspections and plan reviews, and that's also where we house our fire investigation unit. And even through COVID, their numbers are not too significantly down. So the community, there's still some community development and building happening, but we've definitely seen an increase in life safety inspections because with the increase of vendors trying to be a little bit more creative with how they're serving their communities, especially in the restaurant and bar industry, where they're being pretty creative and they are definitely following all the rules to make sure that they get the right permits and everything. And our office has facilitated quite a bit of that. So we've seen a 16% increase in life safety inspections this year, and that's a pretty significant increase. Our permit inspections are right on within about 1% of where we are in normal times. Fire plan reviews and system plan reviews, we're seeing a decrease, but we expect once things get back to normal that will probably increase back to within normal limits. But we're talking 2021 when we expect that to happen. Something that most people don't realize the Fire Prevention Office does is we manage the Community Right to Know program. So if you are a business within the community, and this is the entire municipality, and you're storing any amount of hazardous materials on that site, you have to let the fire department know so that we can catalog it, and we monitor that, and we also share that information with response crews. So if we respond to Walmart, we have a list of the hazardous materials that they have on site, what their quantities are, where they're stored, and it allows us to prevent our hazardous materials incidents from getting significantly worse because we are uninformed of what's all on the site. And our community is very responsive, and the majority of business owners are very good about keeping us up to date on that information. We also, as I mentioned, this is where our fire investigation office is housed. And one of the things our fire investigator does is they review every fire-related incident that we go on to make sure crews identified correct origin and cause, but also to give indications of what the cause was so that we can look at mitigating efforts. And then that information is fed to our community risk reduction office and our fire prevention office. So they work together to help the community reduce those types of fires. And we're within 1% of our normal numbers. And one thing that didn't get included on here, looks like it got cut off, is our fire investigator has responded so far this year to 9 fires that for some reason we needed a significant investigation on. And those could be either large loss of life, because they investigate every fire fatality we have, but also if arson or an intentional, the fire was started unintentional for some intentional reason. Okay, so that's pretty much our stats. Hopefully in October we'll have a little bit more in-depth information so that people can see, ask questions if they have them. I'll go right into. Yep.
Actually, Chief, if I can interrupt you for a second, we've got a question from Mr. Weddleton. Mr. Weddleton?
Yes, sir.
Yeah, thanks. It's always interesting. I had a question, 2 questions actually. One is, you do transports, and I'd like to get a definition of that. And where do private ambulances fit in?
So when we respond, when you call 911 and it's a medical emergency, we send an ambulance and we'll send a fire crew. The fire crew usually gets there first, they help stabilize, and then we put the person in the ambulance. And that's how we define transports, is when we transport a patient from the scene to the hospital. We are only, because of federal law and some other very interesting rules, we are only allowed to transport people to a hospital or an emergency room at this point in time. More to come on that in the future. You'll definitely get educated about that when we talk about another topic. But so that means we deliver patients from the scene to Alaska Regional, Providence Healthcare, and to Alaska Native Medical Center. So those are our 3 destinations we transport patients to, and those are our only options. So even if someone would like to go to an Instacare or their primary care provider, we are not allowed to do that. They have to go to the emergency room at one of the major hospitals. So the private ambulance services, they are responsible for non-emergent transports, like between hospitals, or if someone gets discharged from a hospital and they need to be transported at home, but the family can't get them there, or if they're transferred between Alaska Regional and Providence, or from an assisted living home to a, to see their medical provider, something along those lines. That's what the private ambulance services do. And they, we manage their calls. So if Providence Hospital, for example, has a patient that they need to move to Alaska Regional, they'll call dispatch, and we have 3 private ambulance services here in town, and they're on a rotation. So they pick whoever's next on the list. They contact that entity and say, okay, we have a request for you guys, go from here to here. And we take care of all of we're kind of the middle manager of all of this. All of their questions gets asked back and forth. And then they get dispatched to, and usually those are scheduled moves and transports between facilities. So that gets scheduled, and then they take care of the actual delivery of that service. They don't do any response to emergency incidents.
Okay, good. That helps. Can I ask one more, Chair?
Go ahead, Mr. Weddleton.
So we have coming up pretty quick here, potential changes in our building code, and one is pretty significant increased requirement for sprinklers is proposed. And I assume that AFD would do the inspections on that, and I assume you're aware of that. If that were to pass, what kind of budget impact would that have on you?
We don't expect a huge budget increase because it really is affecting just the continued expansion out into more of the wildland urban interface. We really look at that as an offset because we'll get a little bit more out of a plan review fee for the systems because the sprinkler system will have to be reviewed. So, but it's a pretty small amount considering we don't expect it to be hundreds and hundreds of houses. We are definitely would love to see all residences in this community sprinklered because one, it stops fires, it reduces fire fatalities, and it reduces damage to the building. So this is definitely something we have been advocating for a long time. And one of the reasons why we're so supportive of this is because it will actually reduce builders' costs because now they don't have to extend the hydrant system quite as far as they would have had to if we don't put this in place. So we think it's a cost savings for the builders. I know some of them don't quite agree, but
That's helpful. Thank you.
Okay, I'll go.
Thank you, Chief. Yes, please carry on. Thank you.
Quickly over staffing, and so Anchorage Fire Department, we are funded for 394 positions. We only have a few vacancies at this point. We're doing pretty well. However, it looks like on the chart I sent that we have more vacancies than we do. So, and while a probationary firefighter is still in probation, they don't really count as being within our funded number of positions. Once they come off of probation, then they move into a vacant position and fill that hole. So while it looks like we're short 17 firefighters, we actually have 26 probationary firefighters. So it isn't causing us issues in operations. It's just the way the budgeting and the PCN count looks. We anticipate, so far this year, we've had 19 people on the department retire, the majority of which have been on inline operations. And so that's where those vacancies come from, is people retiring or moving on to other positions. And that's why we do a large academy to make sure we can conduct one academy and then we have bodies to fill the expected attrition for the year. We expect to have another 4 to 6 people leaving. So by the end of the year, we should have absorbed the majority of the probationary firefighter positions. Across the board, the line operations, these are all the 56-hour people. And you have to take that total number and then we divide it by 3 because that's the number of people who are on duty every day, since we're divided into 3 shifts. In dispatch, we have a battalion chief and lead dispatchers and dispatchers, same thing. They are divided into 4 shifts. So every day we'll have one lead we work in 12-hour shifts. So every shift will have 1 lead dispatcher and 4 dispatchers. On average, are what is available sitting and working in dispatch. Our training center, the rest of the majority of the positions are 40-hour positions that support the rest of the department. This first group that I'm looking at are all within our operations section, and that's our trainings group, our health and safety group, our EMS operations management, data systems, and then the management of the entire operations section, which is our deputy chief and an assistant chief. And then on the non-operation side, we have our finance section that makes sure that we bill for all the services that we're supposed to bill for, manage all of our personnel's time, which is very complicated when we have multiple shifts and schedules and the volume of people that we have. And we, of course, have to make purchases and we have to pay bills and all of that. And we do that with a staff of 6 people and they do a spectacular job. Our prevention office, again, is a pretty small office. We have 8 inspectors, 8 inspectors, 1 fire marshal, and our fire investigator. The community right to know position also is kind of a dual role. That's also their administrative assistant for the fire prevention group. We are getting ready to see the retirement of one of our fire inspectors after 30 years with the municipality. She leaves at the end of September, but we've already selected the new person, and they start on October 8th. So we have a little bit of dual coverage with a new inspector, but we'll maintain the same number within that work unit as after our inspector, Rita Venta, retires. And that'll be at the end of this month. You guys have heard me talk about our shop and our mechanics. We currently have 8 mechanics on board, but we're only funded for 7. So we have 1 extra mechanic that we've been carrying because we have people off on military leave or due to work comp injuries or family related stuff. It seems like we always are at least 1 person short. So having that extra unfunded mechanic has come in very handy to help our shop at least stay afloat. We definitely feel we need other resources there. I think you guys have heard me talk about that. And then in the chief's office, we have, it's myself and we have an executive assistant, and we also have a special assistant, and that is Ben Schultz, that he is working through his training program to where he can be successful with another organization. And he's doing some significant work for us when it comes to historical preservation for all of our old data. And that is an unfunded position, but it's really to take care of a situation that we needed somebody with the right skills to be able to do this work, and we didn't have anybody left, so we were able to bring Ben on to do that work for us. One of the concerns I have mentioned before is our diversity stats. AFD is not the most diverse department within the municipality. Line operations were only 3.6% female, which is a pretty small number. And we also, department-wide, we're right about 10%. The majority of the people in our dispatch center and our admin positions are women, but in the other places, we definitely men outnumber us. And race and ethnicity as well. We're very underrepresented in just about every category you can think of to split that up, and you guys can see the numbers there. We are looking at better ways to encourage people to apply for positions within our department from more diverse backgrounds. So if anyone in the audience has some ideas, please feel free to share. We need to get the word out. Right now we are, the application period is open for firefighter. It closes on the September 13th, which is a week from Sunday, and people still have an opportunity to get their application in, so please take advantage of that.
Chief, let me interrupt you for a minute. I do have a question from Miss Allard. Miss Allard.
Hi, Chief. Thank you. So my question is, when you guys are hiring, regardless of race or demographics or regardless of gender, you guys, are we all tested the same? So if someone was to apply at the AFD, that they are held at all the same standards?
Absolutely. We have a single standard. Everyone has to meet it.
Thank you, Chief.
Thank you, Chief. Continue, please.
Okay, and last but not least is our capital projects. We have been very fortunate. The community definitely supports our bonds. We have 2 different areas. We have our fire service area bonds, and those are typically fire apparatus and facilities related items. And then we have the area-wide EMS bonds that were included in the entire area-wide bonding package. Right now we have on order a fire engine for Eagle River, a rehab unit, which will serve the entire community, including Girdwood and Chugiak when needed. Those are in the build process, and we expect them to arrive in 2021. Our self-contained breathing apparatus bond that we received last year, we just finished the rollout and training of all of those new packs, so those are in service. And with the recent 2020 bond, we ordered a fire engine, and it has been designed and the specifications are done, and the bid has been awarded, and we expect that to arrive in late 2021. Facilities, we had a small bond to do some facility upgrades of our alerting system, and the assembly will see that come through. I believe it is on this agenda. And we also received money to look at a shop expansion, and we're on hold for that for a little bit for a variety of reasons, and I hope to have more information for you on that shortly. In 2019, we received funding for 2 ambulances, and those are on order, and we should expect those probably October, November of this year. One thing, we have to get our orders in early, and if we miss certain windows because of the timing of when our bonds are approved, the chassis for our ambulances get sold because they're not special just to ambulances. They're a Dodge chassis that gets used for all other types of vehicles. We have the exact same issue with Ford and Chevy. If we had a different chassis, this is just, there's a shortage of chassis throughout the US. So they take a little bit longer to get here than they should. Well, I think they should, but we also have another 4 ambulances that were approved by voters in 2020, and we expect them to arrive in 2021. This gives us a complete refresh using the new model for all of the ambulances within the community, and this includes Chugiak and Girdwood. So in the future, we won't need to buy a whole new ambulance anymore. We're going to start reboxing. So you'll see the number that we request for the reboxing piece to the community will be a much lower number than we've seen in the past, and that will be huge cost savings, and it's a really smart and efficient way to go. And the EMS equipment that was approved by the voters last year, I'm very pleased to say that we will see the 2 tractor trailer loads of equipment will arrive in September. The training and rollout is scheduled for September and October. So we'll see a complete refresh of the EMS equipment approved by the community will happen here in the next 2 months. And we are very excited to see that. And it's a huge, be a huge impact for our crews, but also for the patients that we serve. And we have 2 other large projects that are not necessarily capital or bond related that are happening, and that is the Supplemental Emergency Transport Program. That was a legislative change that happened 2 years ago, and we've been working with the state on the regulations so that the department can be reimbursed for more of the cost of service for delivering EMS to Medicaid patients. And that will allow us to get more reimbursement from the federal level from Medicaid to, cover more of the cost than just the transport of those patients. And I can provide more detail on that if you're interested. And we are also working on a replacement of our records management system. Right now, we are using, I think, 6 or 7 different applications and software programs to collect data and manage our business. And it's untenable because we can't share a lot of data and we have a lot of redundant systems in place. So hopefully we'll get a new records management system that will be able to meet all of our needs. And that is in the RFP process right now. So I think that's everything.
Chief, okay, oh, great, thank you. Well, I have some questions for you though. So Mr. Constant.
Thanks, Chief. So there's been some interest in a project out of Juneau that I just recently learned about. Have you seen what they've done with their buses?
So yes, I have. The Capital City Fire Department, which is the responding fire department for the Juneau area, they contracted with 2 local artists to develop a concept that makes their ambulances representative of their local culture, and they turned out beautifully. We shared them on our Facebook page. It is definitely a conversation that I think we need to have in our community of how, 1, because it's inclusive, but 2, the apparatus looks spectacular. But I think it would be a great way to serve the community and recognize all of the different types of cultures that are here in Anchorage.
Thank you, and I'm certainly interested in supporting that effort and want to make sure that we're timely. So if there are some timelines off record, maybe just send me a note.
Okay.
Thanks.
All right, thank you, Chief. Are there any other questions from members for Chief Hetrick? And I'm not hearing or seeing any in the queue. So thank you, Chief. Appreciate that very much. But don't go too far because our next item is something that you're well familiar with in terms of how the core teams function. And we kind of want to have that conversation in conjunction with the Anchorage Police Department and kind of their view on crisis stabilization. So I'm not really sure how to completely set up this conversation and get it kicked off. But I think because we are fairly familiar with CORE, I think I might let Chief Dahl kind of start with just kind of his vision or the APD's vision of what it would take to kind of help get APD out of some of that kind of response business. So Chief, do you want to kind of kick off our conversation here a bit?
Sure, thank you. So, you know, there have been a bunch of different names thrown about for different programs, whether it's Crisis Now or Cahoots or some other things, but they all kind of revolve around the same thing, which is this idea of crisis stabilization, which typically is a facility someplace that first responders can drop people in crisis off at, that's available 24/7, and also the ability to respond for those folks to respond out into the world and provide service directly. And that gets traditional EMS and law enforcement first responders kind of out of that loop, or at least out of it faster. And so APD had the opportunity to travel to visit a site that is doing this successfully. Deputy Chief McCoy went, so I'm actually going to turn it over to him and let him talk a little bit about what that looks like on the ground and why we think it's a good idea for APD. So Deputy Chief.
Great, thanks, Chief, and good morning, everyone. So it was about a year ago, we started having conversations with our partners in behavioral health and other law enforcement agencies about how, as a community, we could transition to a behavioral health crisis response rather than our traditional law enforcement response to a person who's experiencing a mental crisis. And so part of that conversation, we discussed, the outcomes. The outcomes for people in crisis have not been great with a law enforcement response. And we've seen situations from across the country where law enforcement responding to a person in crisis has ended tragically in some type of use of force across the country. So I think everyone agreed that transitioning to a different response model is a good thing for the community as a whole. In addition, it's the resources that APD puts forward to dealing with these types of circumstances has been tremendous. As Chief Hedrick discussed in her presentation, when hospitals are on divert, when there's no beds are available, we have officers with people who are in crisis driving around with them for hours in the back of a police car. That's not a very productive use of police resources. And at the same time, it's a horrible outcome for the person who's in crisis, who's in the back of a police car for hours when they need real behavioral mental health assistance. So this type of model would definitely free up officers to be able to devote our time and resources to addressing crime in the community and a lot of the other community concerns that people are asking for daily from the police department, while at the same time providing better outcomes for people who are in mental and behavioral health crisis. So we traveled to Arizona to view their Crisis Now model. And the Crisis Now model, the core components of it are a call center, mobile response teams, and a stabilization center. And basically the way it's set up, it's set up very similar to our current physical health emergency models and our public safety law enforcement model. But a call would come in, a behavioral health call would come into the call center. And the call center is staffed with behavioral health specialists and they're able to resolve a majority of the crises over the phone. About 80% of the calls they receive, they can resolve it over the phone. They're trained and they can stabilize the person. Out of the calls that they're not able to stabilize, they dispatch a mobile response team, and these mobile response teams are comprised of a mental health professional, a behavioral health specialist, or a peer counselor, and they're 24/7 in the field, and they can respond to those calls, and they're able to the calls they respond to, they have a very high percentage rate that they're able to stabilize. Also, around 70% of the calls that they actually respond to, they stabilize in the field. And the remainder of the calls that they are not able to stabilize, they transport to a crisis stabilization center, which again is that third key component in the community, having a place where people in crisis can be taken to, where they're always accepted and able to be treated. And Arizona has been doing this. It's a very, very successful program. We are in high support of it. We've continued conversations with the Alaska Mental Health Trust and some of our other partners, and there's discussion and momentum to bring up 3 sites here in Alaska to do a trial run in Anchorage, Damatsu, and Fairbanks. And so those conversations are still happening. There's a lot of behind the scenes work that's to come together to make that work. But again, it's something that we are fully supportive of and would like to see come to our community.
Thank you, Deputy Chief. I really appreciate that. And it looks like we've got a question or comment for you from Ms. Zolotel. So Ms. Zolotel, go ahead.
Thank you, Madam Chair. Thank you, Deputy Chief McCoy. As everyone knows, I'm really excited about Crisis Now or mental health stabilization. And just as a reminder, through the CARES Act funding, we appropriated $3 million to kickstart this due to some of the accessibility issues of in-person mental health and the additional stressors related to COVID that are being placed on the community. But that saying, could we get a little bit of context in terms of what is APD's call rate right now, like the potential number of calls that could be diverted on a monthly basis from APD to some other response system if it's brought online?
Hey, this
Sure.
is
Go ahead, Chief.
Oh, sorry, Ken. This is Justin again. So that's a good question. I don't have that number off the top of my head. It's actually really difficult to discern because a lot of times these end up getting embedded in other things. And so I really don't have a specific number. I know that question gets asked a lot. Hey, if we do this, like how much resource at the police department does that free up? And I wish I had an exact number for that. What I would suggest is that, essentially it frees up law enforcement officers to do the things that we expect them to do instead of being diverted to do, mental health response. But I don't have a number, and it's difficult for us to identify a specific number.
Thank you. May I ask a follow-up, Madam Chair?
Yes, you're breaking up a little bit, but yes, go ahead, Ms. Zolotel.
Thank you. Would there be utility, in bringing on the in the field mental health first response if we aren't able to simultaneously bring on a crisis recovery center or the call center if we were, looking down the road to get those pieces additionally brought on?
I think I'm going to let DC McCoy talk about that since he's had direct experience with how these programs actually work in the real world.
Thanks, Chief. So the 3 components are the ideal setting. However, if we were able to only bring one online, for instance, the mobile crisis teams, it would be a benefit to the community. However, the problem with the mobile crisis teams that we experience now, we have no place to take people in crisis. So the mobile crisis teams may find themselves with patients who are still in crisis, who need some form of stabilization, and are unable to provide that. But I definitely think having those types of professionals in the field, it would be a better outcome than having police officers responding, trying to triage those types of conditions that we're not equipped to adequately address in the field.
Any follow-up, Ms. Zolotel?
No, that's great. Thank you, Madam Chair. Thank you, Deputy Chief McCoy.
Okay, thank you, Deputy Chief. Please don't go anywhere. I've got a couple more people in the queue. I believe Mr. Weddleton is next. And we need you to unmute, John.
Sorry, hit the wrong button there. Thanks. I have a couple questions. I'll ask all three, and you can blend them together as you want. And one is, what resources do you need? And then I know Chief Dahl said it's hard to unpackage it. Does Arizona have some data on the amount of time and savings that their law enforcement has? And then for that third part, the site for this, what would that look like and where? And it sounds like something we need, but if we go forward with that, we need to do it very, very cautiously, as we've learned. Thanks.
So this is Justin. I'm always happy to jump in when there's silence. I think that going backwards through that, what the facility looks like and where is obviously something that, is totally not a police department issue. It would be up to, the administration, the assembly to try to identify a location. But ultimately, I think probably up to the vendor, right? Most of these models are based on having a vendor provide these services or some other entity other than police and fire. But other than maybe being involved in the discussion, I don't think it'd be up to us to pick a location. With regards to Phoenix and what kind of data they have, I will let DC McCoy chime in. I don't have that, but we could certainly reach out to them and see if that's something that they could provide us. I think it would be interesting to see if they had any information on that.
So I do have some data from Arizona, and their data was from 2017, but they were saying that in 2017, law enforcement in Arizona engaged with 23,000 patients, and they transferred them directly to crisis stabilization facilities, or the mobile teams were able to triage them and stabilize them in the field. And so taking that information, they said that was able to save them basically 37 full-time officers, the equivalent of 37 full-time officers. And the reduced wait times in the hospital emergency rooms, this was a pretty incredible number. They said it was reduced by 45 years. So, and saved hospital emergency departments $37 million in avoided costs and losses. And so it was significant for them. The law enforcement officers that I've spoken to in Arizona, the system has allowed them to address more pressing crime issues in the community. And I'll just give you a quick example. We did a tour of this crisis stabilization center, and there were two little busloads of us going there. So we arrived at the crisis stabilization center, and before we could unload ourselves from our buses, a patrol officer pulled up with a patient, took them inside the stabilization center, came out, got back into his car, and was back in service before our group could collect ourselves to walk in for a tour, which was, extremely impressive for us. And it just showed us that, okay, the officers are back in service. and serving the community, and not tied up on these calls like we experienced here in Anchorage.
Wow.
Okay. Thank you, Deputy Chief McCoy. Any follow-up, Mr. Weddleton, or?
No, that's great info. Thank you.
Okay, great. I just wanted to point out that Ms. Zolotel put in the chat a link for more information from Crisis Now, and it's crisisnow.com. So that might be of interest to people. And then we have Mr. Constant in the queue. So Mr. Constant.
Yeah, thank you. So now comes the part where we have kind of two diverging processes that we should be talking about, so we can figure out if they fuse or prioritize which is the first, or figure out a timeline. And that really is the conversation about the core team as well. So I want to make sure that we're kind of getting to the heart of both of these questions. And so I don't know if that's part of this conversation by plan or not, and I'll just step out and let however that conversation should evolve begin.
Thank you, Mr. Constant. Yes, I think we're all kind of grappling with really how to move forward with this, and just in terms of all the entities that kind of play a role here and how to do something that works for the whole community. But this is good conversation, and this is kind of the most that I've heard so far on this topic. So I'm glad that we're starting it. And so I just wanted to ask Chief Hetrick if she had anything she wanted to add to this conversation as well. Before we, maybe move into more of a committee conversation about where we'd like to see the conversation go next. So anyway, Chief Hetrick, any comments?
Just wanted to kind of answer Assemblymember Weddleton's question. I think he was the one who asked about call volume. In 2019, AFD, we transported or responded to close to 2,300 calls that were behavioral health or sometimes of some type of substance abuse situation that we have. We pulled that data out of our system. That's about 10% of our EMS responses. And it is, we believe it is underreported because if people have an underlying other condition that they get called in for, so if they're unconscious or something along those lines, the primary impression is what we look at and what gets reported. So we know for a fact that there's at least 2,300, but probably more, a much higher number of behavioral health and substance abuse related calls that we go on. And I'll not weigh in anymore. You guys have already heard my spiel about the core team, but I am here to answer any and all questions and we'll be happy to do that.
All right, thank you, Chief Hetrick. And yes, and thank you to the core teams. I think that's been obviously very helpful. And just in terms of how that's all been formulated, it's really helped us kind of gain that awareness for what's going on in the community and how a lot of our emergency response systems are being used. So are there any comments from the committee just in terms of where they'd like to see this particular conversation go? Maybe even Chair Rivera would have a comment about whether or not we just need to go ahead and designate maybe a work session on this. But anyway, open to comments. I've got people in the queue. Let's see here. So Mrs. Zolotel.
Thank you, Madam Chair. I want to make sure my understanding of the core team is actually correct, as currently, at least in operation, and that is to concentrate on folks who are considered high utilizers of emergency services. So there may be some overlap in that the high utilization would be because someone is in crisis, but that often they're repeat callers that then ultimately the core team works with them to diffuse whatever the underlying situation is to reduce those number of calls. Is that a correct understanding? Or Chief Hetrick, if you could help me out.
Absolutely. So it's kind of a mix of what you said. Because we have limited resources, we have focused on the high utilizers because we only had one person, so we had to target a specific group. The majority of those people do have an underlying behavioral health issue, and that's what causes them to go into crisis. sometimes because of failure to maintain medication, or they just drop out of the system, or their behavioral health situation seems to be exacerbated because of some other catalyzing event. They lose a family member who's their support system. They lose they lose their employment or something along those lines. But what we've identified through the program is we've noticed if somebody calls 911 to request services more than 3 times in a week, that's usually a strong indication they're going into some type of crisis. And so that was really what the meaning, or the base focus of the core team was, is if we could get, we have an identification mechanism for those people who are not going to self-report or can't reach out for services on their own. If we could use this system to identify people who are going into crisis and go to wherever they are and help them work through that, then they would not turn into a high utilizer. So the core team was initiated to focus on high utilizers just for resources, but the expectation was when we could smooth out that curve, it would be good if we can then target those people who are just going into crisis and prevent them from, losing their house or just mitigating the crisis early on. And that's why we focused on the request for social, it being a team of social workers, behavioral health specialists, and medical provider, so that we could kind of attack any potential base problem that they were dealing with. Does that answer your question?
Perfect. Yes. Thank you very much for that. Excuse me, for that refresher. I really appreciate it.
All right. Thanks, Ms. Solotel. Thank you, Chief Hetrick. Well, I'm not sure where we want to leave this conversation right now. We're definitely running out of time, but I think the fact that we're getting a little bit more of a well-rounded picture of some of what the goals are, we certainly understand what the problem is, but I think we're going to need a little bit more, certainly some more time to really kind of make some kind of path forward with this to start to materialize and gel. It seems like we have a lot of things kind of in terms of possibilities. So we'll really want an opportunity to nail this down. Chair Rivera, I know you're on with us. Did you want to comment on kind of where we can go from here? Any thoughts at this point?
Yeah, thank you, Madam Chair. So I'm happy to hear your thoughts from the other members on process. Yep. I think it may behoove us to either take this discussion out of this committee, because I think there's a lot of different moving parts that just don't relate to this committee, and potentially have these types of discussions in work sessions where we can bring all of the relevant parties to the table and have further in-depth discussion. Curious to hear from the members if they have any additional thoughts on that.
Okay. Thank you, Mr. Rivera. And yeah, and that was kind of my thought too. So I'm glad to see that we're really all kind of on the same page here. But we have some comments, it looks like, from Mr. Constant and Ms. Zolotel. So Mr. Constant, we'll start with you.
Thank you very much. I think what my mind keeps tapping into is the method that we utilize to come together on the CARES Act appropriations. And I think from the budget perspective, not just from the perspective of Crisis Now or core team or how we're going to address homelessness through the 2021 budget, but all of it, it might be wise that we start to think through some longer kind of day-long strategic prioritization sessions with the administration and us there. So, base our work on something that worked, I think, pretty well. And so, and with the promotional side of that, so the public is really coming along with us in advance, not just after the fact. But I think, to me, scheduling sometime in October around the budget conversation, some really in-depth work sessions would be something I would support.
Thank you, Mr. Constant. Ms. Zolotel.
Thank you, Madam Chair. And I had forgot to mention, and Mr. Constant has reminded me, we do have, as part of the CARES Act appropriation, money set aside for consultants to help us navigate as a body the various options and evaluate the core team proposal, the Crisis Now proposal, other proposals, so that information can come to us both in terms of what meets the needs. We fully expect that Deputy Chief McCoy and APD and the Chief Hetrick and Fire Department and the administration will all be involved in working, just like we did with the port, to evaluate the options and get recommendations as to the best path forward, as well as financial sustainability, ongoing costs, and other ways that the services could be paid for. So that's moving through the system for that consultant, and hopefully we'll have an update by week's end that we can provide. But I did want to remind us of our resource that we have.
Thank you, Ms. Solotel. Yes, and I absolutely just want to say that I think we're beginning to really come together on this, and that's a good thing. I was hoping we could kind of spare ourselves the expense of a consultant, but I can also see that there may be some value in that as well. But I absolutely appreciate the efforts that the fire department has already put toward trying to alleviate some of the impacts on our system through providing what they do through the core teams. And I very much appreciate the information and the extent to which Deputy Chief McCoy has gone to gather some information there too. So I want to make sure we definitely, kind of use the resources that we really do have already and some of the groundwork that's been laid already too. So I think at this point, I would agree though with Mr. Rivera that it's a good opportunity for us to turn this into a work session, and because it is definitely bigger than just what this committee would typically handle. So anyway, good conversation, everybody. I think it was important for us to kind of have a little bit of an understanding so that we can move forward in a more structured way. So I think we will do that. So if there's nothing else on that particular item, I will just kind of move us on to a little bit of a conversation about the answers and actions document, kind of our the Public Safety Committee's community checklist that we came up with after we had the conversations with a lot of the different community groups and individuals. And I don't know how many of you had a chance to really look at it, but I kind of tried to organize it in a little bit of a way that we could actually use some of the information that we gathered from those conversations to structure some questions that were basically being asked versus what were some of the comments and hopes of things that people thought we would begin to work on. So I don't think we're going to have time to really run through that so much, but I hope you'll take a look at it. And I know Co-Chair Perez Verdi and I will definitely spend some time trying to finesse that a little bit. But if there's any comments, I certainly want people to chime in, and I'll kind of leave it open here for a minute or two if anybody wants to comment on that. But obviously it's a draft. We're not by any way, shape or form ready to really put it online on a regular basis. But anyway, any comments? And I'm not seeing anybody in the queue and not hearing anybody. So suffice it to say that we'll be dealing with that some more. So. And then the alcohol tax funding item is on there just so that we kind of remember that we've had several presentations in this committee in regard to what the Anchorage Police Department, the Anchorage Fire Department, the Department of Law, and even through the Health Department, we did have a presentation, in terms of how we think that funding should be used. So I just want to make sure that everybody kind of keeps that information in the foreground as we begin to have that bigger coalescing conversation with the full assembly on that topic. So I don't know if there's any comments on that one in particular. So I'll wait a minute to see if anybody has anything they wanted to add to that. Mandy was just reminding me in the chat that yes, we did hear from the Department of Law. Ms. Stanley couldn't be with us today, but she did send in another copy of what they are suggesting that we use the funds for, and that was to add another prosecutor and do some technology updates in their data system. So Just a reminder on that one too. So, okay, so have not seen any comments here. Oh wait, might have somebody else in the chair. Oh, we might have Miss Stanley online. So I will just say, Miss Stanley, we didn't give anybody an opportunity from the Department of Law in any of this discussion. So if there is something that you wanted to add, particularly on this item, please join us.
I just wanted to reiterate, I made a couple changes on the form that I sent in, just altering a couple of the data of the technology pieces. Basically, our department is looking towards going paperless ultimately, which would help us, it would really help us streamline communication with APD and the court system. It would help us serve victims better because we'd have access to bail conditions at all time of night and day. And it would free up a substantial amount of staff time and attorney time so that we could really turn our attention towards some of our areas that are tricky, such as serving homeless victims, so, you know, paying attention to some of the victims' needs and the alternative courts. We do a pretty good job, but any time that we can take resources that are spent on office processes and redirect them towards serving victims and working better with APD, the better it is for the community. So that's all I have. Thanks.
Okay. Great. Thank you, Ms. Stanley. Thanks for updating us on that. So again, like I said, we want to make sure we keep all this information in the forefront as we have this alcohol tax funding conversation. I have Mr. Dunbar in the queue. So Mr. Dunbar, go ahead.
Thank you, Madam Chair. So Ms. Stanley, the conversation that I think we may have had, but we certainly had with the prior municipal prosecutor was about when we increase resources to our prosecutor's office, what is the concomitant increase in the defense contract? And so I'm wondering, I apologize, I don't have the document in front of me here, but what kind of increase in the cost of the defense contract would you expect from adding prosecutors' resources?
That's a good question. We are not talking about increasing the number of cases, but I understand what you're saying about, yes, proportional increase. That I'd have to talk to Civil about that because they have all the details of that contract at their fingertips, and I'm afraid I don't because they negotiate that. But I don't, adding one prosecutor, I don't know if that would trigger adding a whole nother defense attorney because we do not operate at a 1-to-1 ratio right now.
Yeah, thank you. So I guess a quick follow-up, if I may, Madam Chair.
Yes, please go ahead.
So I think that I would just urge you, Ms. Stanley, to when you're putting together that request to also try to factor that in. I mean, it might be true that we're not handling more cases, but presumably you're adding another prosecutor for a reason, so that you could take more cases to trial or get through cases quicker. I'm not sure if we're not doing more cases, then I'm not sure why I would have another prosecutor unless it was for something like that. So if that's the case, then obviously the amount of money that we spend on defense is also increased. So I know you don't have the stats here now, but I guess I would just ask that Civil be included if they're the ones responsible, and that we keep that in mind when we go forward with that request. Thank you.
Absolutely. Absolutely. Point taken. And I will confer with Civil, and I will add a line item for defense contract in that.
Thank you, Madam Chair.
All right. Thank you. Thank you both. Well, we're just about really out of time. If we could extend for a few minutes, I think we do have a couple more people. Well, we have one more person in the queue, and I would like to give the public a chance to speak if there are people out there that really want to do that.
I don't think we need a motion, do we?
That's what I'm asking.
Procedurally, I don't think we do.
All righty. Well, Mr. Constant, you are next in the queue, so please go ahead.
Thank you. Chief Dahl, I just want to say thanks for giving us the report on the DNA testing staff that's been hired. As fate would have it, I was driving down the highway this morning from Eagle River to Anchorage and found myself next to Mr. Dyson in traffic. And so while he's a very studious driver and he did not look left or right to see me, I will be reaching out to him today to let him know that at least that part of his goal is met. And so I'm really grateful to you for that.
Oh, excellent. Thank you. Thanks for passing it on. I know he'll be interested.
Thank you, Mr. Constant. Okay, if there are no other comments at this point from the committee, then I'm going to open it up to audience participation. And Mandy, you'll probably have to help me with this because I don't see, I don't really know who some of these numbers are. But just in general, if there's someone that wanted to comment, you have, let's say, how about we say 2 minutes because we're already past time. But anyway, you'll just kind of have to chime in and you have to do in order to unmute, if you're by phone, you'll have to do the *6 on your phone. So do we have anyone?
Hello?
Yes.
Hello?
Yes, sir. Go ahead.
Okay, Eugene Colhaven, to be very, very brief. Number one, the notice of the meeting was from X time to 12:30. You did need a motion to continue the meeting because if you have a continuation of the time you advertise, you need to do a motion. Some member Constance wrong. Second, and again, I'll be very brief. The information for the meeting was on the site, and I saw it there and listened to the entire meeting. But again, I'd like to remind you, some of your other committees, the Rules Committee, and there is a meeting today, you're going to have the Assembly Ethics and Elections. That information is the way the site is set up is not there. You have many sites that you click on for this meeting, and you can click on, you see web page and click on there. But for the ethics, there's no information there. So when those meetings happen, where can we get that information? The public can't. Occasionally you do go and utilize the section where the work sessions are and put that information up there occasionally, but that's not consistent. And the Rules Committee that you had the last time, which I addressed, which I didn't mention last week, we couldn't see. We did not know. When I say we, the public, we don't know what your agenda is. Maybe you have it, but the public, because of that lapse of not having the site set up that way. And the last thing, and respectfully, I've yet to see a press release on that meeting that you had for last Monday, but the note of 60 advertised to the public, well, 60 of people in the room, does that include all the bureaucrats and the politicians? And that may leave only 5 members of the public to walk into that room. It's not really clear. If you say 60 for that room, then the end result is hardly anyone from the public can be in that room at the Lissette Library for your meetings now. And that closes my comment, except that you should leave more time for the public and not have that restraint of cutting back less time for the people to speak. Thank you very much, and I wish you all the best.
Okay. Thank you, Mr. Haberman. Is there anyone else that wished to speak at this point? So I'm not hearing anything, and doesn't look like we have anything else in the chat. So with that said, I will entertain a motion to adjourn.
Move to adjourn.
All righty. Thank you. This meeting is adjourned. Thank you all.